In this video, we'll discuss about systemic peptic ulcer. Complete GI tract, gastrointestinal tract, have four layer. This is mucosa, this one is submucosa, muscularis, porphyria, and adventitia. So these are the four layer gastrointestinal tract having. Here this part is the ulcer, discontinuation, bridge. Okay, so peptic ulcer, bridge in mucosa. Bridge is ulcer. Here that bridge name is called as ulcer. Sometimes it is penetrating throughout. Okay, so it will penetrating inside also. How to define? Breach in the mucosa of alimentary tract, gastrointestinal tract. Breach in that mucosa of gastrointestinal tract is known as ulcer. Where it will occur? It will occur in two locations. One is stomach and another one is duodenum. Stomach, it is known as gastric ulcer. Duodenum, it is known as that duodenal ulcer. Both together it have that name peptic ulcer. So breach in that mucosa of that alimentary tract, it extend through this region also. Okay, throughout muscularis, porphyria, and adventitia, this part also it can penetrate. What are the risk factor for peptic ulcer? There are two type of stress. One is psychological, another one is physiological. Whenever we have exam, any interview time, that psychologically increase HCl in stomach and duodenum, so it will cause breach in mucosa. Whenever we have anxiety, that time increases HCl production, so it leads to breach in that mucosa. Second one is physiological condition. It may be shock, severe trauma, septicemia. These condition also increasing HCl secretion in stomach that leads to ulcer. Now there are two type of peptic ulcer. Another special two type of peptic ulcer. There are curling ulcer. Another one is cushioning ulcer. Curling ulcer, when we have severe burn whole body. Okay, so whole, because of burn, it producing severe pain secreted high amount of acidity, HCl secretion will happen. Second one is cushioning ulcer, intracranial lesion, tumor in brain. Suppose this one is brain, here some face occupying lesion present. Here lesion is present, that means it will cause extensive vagal stimulation of intracranial lesions. So it leads to hyperactivity, that means HCl synthesis increase. So two special type of peptic ulcer: curling because of pain, cushioning because of intracranial lesion, because of tumor. There is no space, so here excessive stimulation of HCl. Next, etiology. Why that ulcer occur? HCl present in the stomach when eating non-veg. This one is the non-veg. Now meat presented in stomach. HCl to digestion and degradation. So that HCl only degrade that meat material. Why HCl not coming to outside? Not coming to outside means some productive layer is presented. Here that mucosa, it containing bicarbonate lining and increased blood flow. These are productive factors. So etiology, there are some productive factors and damaging factors. Two factor is presented, productive factors and damaging factors. First one name is called as aggressive force. Second one is defensive force. So aggressive force examples gastric acid, that is HCl, pepsin and H. pylori. It is a gram negative coccobacilli. It causes breach in mucosa. But defensive force bicarbonate, mucus and prostaglandin. In normal humans, that aggressive balance between these aggressive and defensive factors, both are equivalent and opposite. Whenever due to any factor the aggressive factor increases and defensive factor decreases, it will leads to peptic ulcer. That is the etiology of peptic ulcer. Whenever this aggressive factor increases and defensive factor decreases, it leads to peptic ulcer. First type of classification, gastric ulcer and duodenal ulcer. Ulcer presented in stomach name is called gastric ulcer. Ulcer presented in duodenum, that name is called duodenal ulcer. This one is the first type of classification. Another type, second type of classification, benign tumor and malignant tumor. And comparing to stomach, the duodenum having more common ulcer, 4 times higher. Overall peptic ulcer, what are the common site of duodenum? First one is duodenum. Second one is pyrolus. Third location cardia. Fourth location gastrojejunostomy. Fifth location Meckel's diverticulum. So these are the 5 location: duodenum, gastric, stomach, cardia, GJ stomy, then Meckel's diverticulum. In duodenum, first part of duodenum in anterior wall, duodenum. Stomach, pyrolic antrum. Duodenum ulcer is the most common, gastric ulcer is less common. Then benign tumor and malignant tumor. This one is that very smaller one. This one is the larger one. This one punched out, sharp margin. So it having sharp margin. This one is large and rolled over margin. It is smooth. This one is the sharp one. Then ulcer, they have 4 zones. Okay, it having 4 zone. This is that mucosa, this one is the submucosa. So first layer here mucosa, here first zone necrotic. First mucosa layer, this one breach mucosa. So here breach mucosa, that means discontinuation. This portion is ulcer. First layer is necrotic. So this first layer necrotic. So this zone is called necrotic zone. This one is the floor of ulcer, just below neutrophil containing region. Here neutrophil containing region. Here inflammatory cell is presented. Neutrophil, few lymphocytes are presented here. It is called a superficial executive zone. Superficial executive zone. It containing neutrophil. Third zone. This one is the third zone. Here abundant of capillaries. This zone is known as granulation zone. Okay, it containing capillaries along with the inflammatory cell. Capillaries along with the inflammatory cells. Fourth zone. This one is the fourth zone. Cicatrization. 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 Here you can see fibrosis here presented fibrosis. These are the microscopic view of ulcer. Necrotic zone, superficial executive zone. Here lot of neutrophil presented. Third one is abundant of capillaries is presented. Granulation zone. Fourth one is a fourth zone containing fibrosis. So it have that name cicatrization. Cicatrization. Now discuss about two type of ulcer different. First one is incidence. This one 4 times more common than gastric ulcer. This one is less common than duodenal ulcer. This ulcer mainly affected young patient 25 to 50 years. This one after 50 it can affect. Both are common in male. Okay, so both ulcers are common in male. 4:1 ratio. This one 3.5 to 1 ratio. Next, different clinical features. This one, this pain food relief pattern. That means eating food decreases this pain. But here food pain increases. Food pattern. Here food pain pattern. Whenever there are eating food, that time increases this pain. The reaction acid causes pain. Then night pain is common. Here no night pain because night time they do not eating anything, that HCl secretion, so it causes pain. After night 8 to 10 hours food free interval, no food, but here secretion, basal secretion of HCl. Wait, okay, either eating or not eating. Basal secretion reach duodenum and causes pain in duodenum, not in gastric ulcer. Then here vomit containing blood, bleeding. So that condition name is called as melanina. Melanina. Here no vomiting. Okay, here no vomiting. But stool containing blood. Here stool containing blood. That condition name is called as hematemesis. Hematemesis. Vomit containing blood. That condition name is called as melanina. That stool containing blood, that condition name is called as hematemesis. Here no loss of weight, no, because no pain doing eating, but here significant loss of weight, not eating. So because patient choose here plenty of diet, not spicy fried food. Okay, so here they don't want to eat. After eating it causes pain, so that reason only it causes loss of weight. So here duodenal ulcer, no choice. Okay, no particular choice of diet, but here the patient choose blunt diet, not spicy, fried item, curries, etc. These are the item increasing that pain. Then entire abdomen, this 9 quadrant where the stomach and duodenum is present. Duodenum here. Okay, right hypochondrium. Right hypochondrium. Here stomach presented in middle line epichondrium. Duodenum ulcer, right, hypochondrium, stomach in epichondrium. Then here marked seasonal variation. Here no seasonal variation. Then more common in patient have greater stress because of anxiety. This one more often in laboring group that working unskilled manual occupation. Complication, there are three complication. First one is hemorrhage or bleeding, all ulcer bleeding. So this one is the most common complication, common in posterior wall duodenal ulcer, leads to iron deficiency anemia. Severe bleeding may causes coffee ground vomiting. So that blood along with the vomit, that condition name is called as melanina, we already known. So name of that artery bleeding which will occur, ulcer is going to mucosa, source of mucosa, there is artery will degraded or degenerated from ulcer, they will be bleed, that's why bleeding. So because of the mucosa, submucosa, both layer affected, that reason only bleeding. Why here that artery of duodenal ulcer name is called gastroduodenal artery. Then which artery causes gastric ulcer? Left gastric artery. Second complication, perforation. Second most complication of peptic ulcer disease, perforation. This one is emergency, admitted patient to operation theater, most common cause of death also. So here more common in anterior wall duodenal ulcer, duodenal anterior wall ruptured, bleeding from posterior wall and rupture from anterior wall. So it's opening. So it this diagram is there. It opening abdominal cavity, all the food will come out. The diagram is there. So the diagram rupture, it having hole through that opening outside abdomen cavity. Then third and rare complication, malignant transformation. Chronic duodenum ulcer never turn malignant, but less than 1% of gastric ulcer may transform into carcinoma. So 1% of chronic ulcer, gastric ulcer leads to carcinoma. If taking treatment also, not taking treatment also, they may be cure or try to heal. Two way the diseases, whether it decrease or increase. Okay, so if complication increases means complication, decreases means healing. What is healing? Last step of healing, scar formation. So we know that scar formation. So two possibility. So first one is longitudinal. Okay, this way that curing process will occur, otherwise this way that curing process will occur. Finally two way of healing. So two type of scar formation. First one is teapot stomach, second one is R class stomach. R class stomach, how it is that stomach safe? Due to longitudinal, like this way means teapot shape, this way means horse class shape. So this one is shortening of gastric ulcer at lesser curvature. This one is that saddle shape ulcer. Cigarcia concentration. R shape means cigarcial concentration. Next, investigation. Invasive test, taking biopsy insert patient body. This endoscopy. Invasive test, this test taking biopsy, patient not comfortable, so we refer to non-invasive test as good as biopsy. So first one is screening test. What is screening test? Here radio labeled urea is broken down into radio labeled carbon dioxide by urease enzyme, which is detected by breath analyzer. H. pylori infection. 95% of ulcer associated with H. pylori. How will do this test? This one is the glass of urea. Okay, radio labeled urea which containing carbon to drink that patient. If H. pylori presented means that urease enzyme is presented. H. pylori is present, absent means H. pylori absent means urease enzyme is absent. Suppose presented means it will split this carbon dioxide plus water. This carbon dioxide because of urease enzyme it will split carbon dioxide and water. This carbon dioxide go to blood and it will go to lungs. Then exhale in that breath. Now that breath analyzer, after 5 minutes patient exhale in breath analyzer. It shows radioactivity of carbon dioxide. If H. pylori present means urease, H. pylori absent means urease absent, not split carbon dioxide. So it give negative result. H. pylori is present, that means urease present. It converted into carbon dioxide. By using breath analyzer we can identify it. Next, gold standard method, biopsy taken using staining name is called as silver staining. Silver staining or Warnithan starry stain. Warnithan starry stain for identification of H. pylori. So this one producing rod shaped cells. Okay, that mucosa, this here rod shaped cell H. pylori we can identify it using silver stain or Warnithan starry stain. Then most specific investigation method, scroll medium, culture of bacterium we are using Scrow's medium. Then treatment purpose, triple trex therapy, combination of lansoprazole, clarithromycin, metronidazole 2 for 2 weeks. So treatment purpose, triple trex therapy, combination of lansoprazole, clarithromycin and metronidazole for 2 weeks. So in this video discussed peptic ulcer disease. 2 locations, stomach and duodenum, both together name is called peptic ulcer. Then risk factor, psychological and physiological. Special type of ulcer, curling ulcer, cushioning ulcer. Then etiology, 2 factor, aggressive factor, defensive factor. Aggressive factor increase, defensive factor decrease means it leads to peptic ulcer. Then second classification, benign and malignant ulcer. This one is the 4 zone of ulcer diagram. This one is the microscopic result. Then difference between duodenal and gastric ulcer. Complication, first condition bleeding, here vomiting, melena condition. Then perforation, it make a hole. So food will come outside. Sometimes chances, 1% chances for tumor. Then scar formation, 2 possibility, teapot stomach and hourglass stomach. Investigation, screening test mainly urea breath test. Because of urease enzyme presented means H. pylori positive result, otherwise negative result. Gold standard staining method, silver staining or Wharton starry staining method. Treatment triple tracks vaccine for 2 weeks. Thanks for watching.